Fam, we are here. And guess what? We are about to get into something that is a hot topic for a lot of people. It affects millions and millions of individuals around the world, and myself included. What is this thing we call anxiety and depression? How does it affect an individual? What are some of the things that you can do to work through anxiety and or depression? What are some of the things you might look for? Are people misdiagnosed? Is anxiety really an illness? Can you cure it just by, hoping? Some of the things. Here's something to talk about. Anxiety is not an illness. Family, that is a myth. Anxiety is an illness. It is a legitimate Okay, and we're going to try this again. My cat does not like the fact that I have a loud voice. Sorry, Kobe. We're going to try this again because what just took place was something that would make me normally have anxiety. But since today has been a day, and we're going to talk about all things anxiety and depression and how, unfortunately, these annoying little things that affect so many people are intertwined with one another. And that kind of sucks. One of the things, anxiety isn't a real illness. So people think that, oh no, it's not, whatever. Anxiety is legitimately a diagnosable psychiatric condition. Family. Facts. It is. Okay, so the information that I am going to give you now is from the Recovery Village. I will include the information below, and I'm also going to be pulling information from a couple of other sites, as well as giving you my own personal experience and the things that I have dealt with and continue to deal with from the anxiety and depression disorder. You don't necessarily have to have the both of them, but for me, they do go hand in hand. So some of the things that you might experience, symptoms that you might have when you are dealing with anxiety: tightness in the chest, a racing heart, pitter patter, but not in a good way. Difficulty concentrating because your brain is just so all over the place. Fear of no longer being here or losing control. Those are some of the things. Okay, another one, difficulty sleeping because you're so worried. Like what I said earlier, your brain is going to be all over the place. I mean, for me personally, it's like I feel like I have all of these things that are going on all of the time in my brain. I can never really truly get them to fully settle down. I try everything. I'm going to talk in a little bit about some of the things that I do to try to get my brain to just chill. So there could be a number of symptoms that you experience, and typically the symptoms that you experience last for approximately 6 months longer before you can get an actual diagnosis. Now, some people have these symptoms that last for far longer than that, myself included. Let's talk about it. Again, family, remember, the information that I'm giving you is being pulled from the Recovery Village. But this is something that is so very true. I can speak to it 100% from my own dealings. Anxiety will go away on its own. It doesn't matter if it's somebody that does not have the proper credentials to diagnose you, somebody that does not understand anxiety. But, you might hear, you're just, maybe it's just stress. Maybe you're just a little heightened right now because of whatever it was that just took place. Do me a favor. just go make sure that you seek professional observation and help. Don't allow somebody in your life, they love you, right? But they are not in a position to be able to diagnose you. So anxiety is not going to go away on its own. Go have a conversation with somebody. So just like anything else in life, ebbs and flows, ups and downs, peaks and valleys, you could be at a stage in your life where everything seems to be going fantastic and life is good. And you're like, yes, sir, let's do this. And you're able to get into your normal everyday activities, not experiencing like very little, if any, anxiety. That does not mean that it's gone. Just like I said a moment ago, ups and downs, highs and lows. So your anxiety can change with, it really is dependent upon what's going on in your life. And that is why it is so extremely important to go and have that conversation. Go and have a conversation with somebody that is a professional that can give you an accurate diagnosis. So in a little bit, we're going to talk about me more specifically with my anxiety and what I have encountered and dealt with, the obstacles that I have had to overcome. But this next myth it's a good one. Okay, because let me just be real with you, family. I put myself in stressful situations on a regular basis, not because I am trying to, I don't know, for fun, but you want to see yourself grow. So stepping outside of your comfort zone, doing something that you would not normally do. This might be a stressful situation. The myth is this: people that have anxiety should not be in stressful situations or put themselves in stressful situations. I call BS. Absolutely, you can put yourself in a stressful situation. That is how you grow. That is how you learn. Let's talk about it. So again, the myth: people with anxiety should avoid stressful situations. The fact is this: stress is unavoidable. Life, family, is going to throw curveballs, batter up. Anxiety treatments, different coping mechanisms can help you deal with those stressful situations more effectively. Utilize your resources, okay? If you suffer from anxiety, you might have different triggers, things that can increase your symptoms, things such as this: personal, professional conflict, facts, social situations, maybe if you have like social anxiety, certain phobias. Feeling claustrophobic, public speaking might be one. Fears about your health, or again, unfortunately, not necessarily knowing how to deal with the thought of no longer being here on this earth. Okay, then we're going to talk about this next myth, which is anxiety disorders are not common. Here's the deal, family. People may not want to talk about it. But the fact of the matter is that anxiety disorders are very, very common. A lot more people than you know have anxiety, and it could be on different levels, right? It doesn't have to, everybody's the same, because we're not one size fits all. Anxiety is actually the most common mental disorder, believe it or not. And it says about 33.7% of adults in the United States will experience an anxiety disorder in their lifetime. Now, I will go back and check the date of when this was published and include that information below. Things like this. This is, again, coming to you, Raw Dee, series underneath Unapologetically Dee, real people, real conversations, and we want to make a real impact. Keep with me. So I said earlier, 33.7% of adults in the United States will experience an anxiety disorder in their lifetime. Here's some additional information. Specific phobias or fear of a particular object or situation, that is inclusive of 15.6% lifetime prevalence. And then the social phobia, which I think I described as like social anxiety, with a lifetime prevalence of 10.7%. So different anxieties show up in different ways, although the symptoms may not always be obvious. It's a good possibility that you know somebody that is close to you, not even just an acquaintance, somebody that is close to you that actually suffers from an anxiety disorder. Sister girl. So it says, even though anxiety disorders are common, they might not be discussed publicly. I can tell you right now, in the African American community, anxiety is not something that is talked about a lot. I'm loud and here I am. I'm not afraid to say it. But some people are afraid. They are embarrassed, stigmatized by the symptoms that they are experiencing. And it's important to understand what the signs are. I'm going to go over some additional ones. I've already said some earlier, but I'm going to go over some additional ones, not only for people that may be experiencing these, but also for those individuals that might witness somebody that is experiencing it and want to be educated on exactly what that is. Myth number 5, panic attacks can cause you to faint. Here's the fact. Fainting during a panic attack is actually rare. I've had plenty of them. And these next couple of things that I'm going to talk about, I've experienced. They are different for different people, but some of the symptoms might include a racing heart, difficulty breathing. A lot can be connected to the mental side of it. For me specifically, I can say that just the thought of it and how your brain starts to work, and it's kind of just this vicious cycle. And you think about one thing and then you start thinking about another thing. And you're like, oh my gosh, my heart is racing so fast. I can't breathe and I'm going to pass out. And then you start getting afraid that you're going to pass out. And it's, like I said, just this vicious cycle. And the symptoms that you are experiencing become worse because of the symptoms that you are experiencing. Say that again. Shaking my doggone head. Just to round out that myth number 5, so there's different things that you can try to do when you kind of feel that onset of the symptoms that are coming. Here's some of the things, and as we get further into these series, I'll talk about some of the things that a therapist that I had in the past told me to do. If you like to meditate, okay, fantastic. That is a great one. You can try to get yourself to an area where there's an exit. Maybe you might be able to get some fresh air, somewhere to be alone, lay down. If you are underneath the advice of a doctor and taking medication, and it is something that you can do in the spur of what you feel is going to be an anxiety attack, then you by all means can do that. There's some breathing techniques. We will talk about those. Let's get into it. Let's talk about myth number 6 because it goes hand in hand with number 5 and what I just said about breathing techniques to help you when you feel are heightened and you feel like you are having the onset of an anxiety attack. Myth: breathing into a paper bag prevents hyperventilation. Family, don't get a paper bag. Breathing into a paper bag, here's the fact, is unlikely to prevent hyperventilation, but breathing techniques can help reduce the likelihood of hyperventilation. So remember I said, let's get into it. Alternative breathing exercises that can be effective in managing hyperventilation: holding your breath, yoga breathing, diaphragmatic breathing. So diaphragmatic breathing. Sorry, sometimes I get myself tripped up when I read words. We're going to talk about that because I use that in my cycling classes. Okay, let's say that word one more time. Everybody together. Diaphragmatic breathing, something that I utilize in my cycling classes. It's a very intentional way to breathe, taking the air in through your nose, expanding your chest as much as you possibly can, then blowing the air out through your mouth. Now, it might seem silly. It might actually seem very simple, and it is just that. And that is one of the reasons that I love it so much, because it is going to work. It's not like you got to go look up some crazy, oh my goodness, what do I need to do to get myself to not be anxious? No, take the air in through your nose, blow it out through your mouth. Be very intentional with it. It will help you to bring everything down. everything down, which is what you want. Myth number 7. Social anxiety is the same as being shy. Abso-freaking-lutely not. When you're shy, it could be a part of your personality. When you have social anxiety, you legitimately feel like you might freeze when you go out in public and you're with other people. It is something that legitimately can cripple you and make you feel as though you can't even breathe, which could potentially be the onset or cause of an anxiety attack. So let's talk about some facts. Social anxiety and being shy are not the same. I've already said that. There's multiple differences between the two. Let's get into those. So I said earlier, being shy could be a part of your personality. I'll talk about a little bit about that more in just a couple of seconds. But so social anxiety disorder or social phobia involves a persistent fear of going into a social setting or a situation, extreme worry about the performance of a person. They have that worry about their performance in a social group. They are extremely preoccupied with the fear that they're going to embarrass themselves or be scrutinized by their peers in a social setting. And they often will avoid a social situation or experience extreme anxiety or even panic in the lead up to whatever that event or situation might be. Somebody that's shy might have social anxiety, but the two are not the same. So I said the two are not the same. A key difference between shyness and social anxiety is the level of distress that one person will experience. If you are shy, your heart might start to beat a little bit faster. You might even get a little bit of sweat on your brow. But family, when you have social anxiety, like I said before, you literally feel like you cannot breathe. Like you're not just having a little drop of sweat. You look like you just came out of the sauna, maybe even walked out of a house in Miami, Florida, or something like that. Mexico, like we were just at. Like it, you feel like you are like almost like it's like an out of body experience where you feel like you're there, but you're not there. And you really don't want to be there because it's making you feel like that. Let's get into it. So we're going to get into that. I said, let's get into it. Social anxiety, social phobia, like I said, can be crippling. It says it can be extremely debilitating and isolating. If you have this disorder, you don't want to go out and be with other people because you just don't know if whether or not when you get there, if your anxiety disorder is going to take over. Because if it takes over, then the people that are with you are going to be concerned. And that is another reason why it is so important to be able to look for and or identify some of the symptoms or have those conversations with the people that you love, because you really just don't ever know. And there are ways that you can be supportive. So let's talk about that and how some people just don't know. So I say sometimes people just don't know. Family, sometimes people just don't know. The myth number 8. It's obvious someone has an anxiety disorder. BS! Fact, anxiety disorders are often not noticeable. It says this, although anxiety is extremely debilitating to those who suffer from it, it is often not noticeable to people around them. It can often be hard to tell if someone has an anxiety disorder. This is not because they are not struggling, but it might be due to a few key things. Let's get into those things. Feeling embarrassed or ashamed of anxiety symptoms, using other excuses to avoid anxiety-inducing situations. There's more. Keep on giving them to me, Dee. Experiencing situation-specific anxiety or panic attacks in private. Let me say that one more time. Experiencing situation-specific anxiety or panic attacks in private. Coach, yes, that is something I have experienced. That is something that is me. Coping strategies that keep their symptoms from being noticeable. That would be me too. As a matter of fact, every single one of the things that I have just said and read from, again, the Recovery Village, which is where I'm pulling all of my information on today's episode of Raw Dee, episode 1, series of anxiety, depression, and really how it affected me. All of these things, symptoms of anxiety that can be so overlooked. Let's talk about that. So I said, let's talk about it. It can be overlooked. People don't know. Symptoms of anxiety are psychological. They might not present themselves in a physical reaction. Visible panic or apparent distress. People, including myself, try their very hardest to cover it up because we're anxious about the fact that we have anxiety, so we try to cover it up. Working very hard to do that. And this can make the anxiety worse or more difficult to manage. Again, it doesn't have anything to do with the people that are around the individual that has anxiety on whether or not they're able to pick up on it, because we can get very crafty. We can get very, very crafty. We figure out ways to, disguise, camouflage it. Oh, we're good. We're very good. Family, had to put my glasses on and read this last one because this is myth number 9. Medication is the only way to manage anxiety. I can speak to this 150 million% from my own experiences. Wait until we get into some of the following episodes in this series, because family, when I talk about all of the different medications that I have taken, been prescribed, what they did to me, why I said, hell no. The myth is that medication is the only way to manage anxiety. Fact is this: there are many ways to treat anxiety disorders. Many. Okay, fam. So I said the fact is that there are many ways to treat anxiety disorders. Yes, there are. Many different types of anxiety disorders exist, and they can range in symptoms and severity. In the same way, there are many different treatment options available to you experiencing anxiety. Medication is one option, and it can be life-changing. However, there are effective alternatives. Let's talk about some of the different treatment strategies for anxiety, what all is included. This is just some of them. Medication and relaxation techniques. Again, the breathing things that I talked about earlier, relaxation techniques, we'll get into that in a future episode. Cognitive behavioral therapy. Again, I'm going to give you some facts on that down below. Individual or group-based strategies, therapy you can do in a group setting. We're going to talk about some more. Okay, so we talked about 3 different things. Here's a couple more, not a couple of more. Exercise. And if you're on my page or you follow me on IG or TikTok, I'll include my social information below. You already know exercise is my jam, family. Exercise is my jam. So that is one of the ways that I use to help manage my anxiety. Problem-solving strategies. So I'm going to talk a little bit about one of the things that I was, suggested to do with a previous therapist, placing myself into a scenario that caused me anxiety when I was in a safe space and utilizing some problem-solving strategies to get through that. We'll talk about. Okay, so anxiety management strategies can often be combined. Yes, you can have therapy in addition to medication. if you want to go that route. You can utilize meditation and exercise. These are just, different combinations. I'm going to speak specifically to what I have chosen to do as I've gotten further along in my journey dealing with not only anxiety and depression. The best treatment method, I will say this, for any particular individual really depends on the type and the severity of the anxiety disorder that you have, as well as your personal background and preferences. Anxiety disorders can often co-occur with other mental health conditions. We'll talk a little bit more about that in future episodes, and it should be factored into the treatment plan. Again, future episodes. So again, family, I said that all of the information that has been pulled today was from the Recovery Village. We talked about 9 myths about anxiety in this series on Raw Dee. We're going to be talking about anxiety and depression, as well as how it has affected me in my life previously, currently, and some of the things, strategies, and techniques that I am using to work through anxiety today. And the fact that, again, healing is healing, right? It is your journey. This is Raw Dee, underneath Unapologetically Dee, real people, real voices. I want to make a real impact, and that, my friends and family, is why I am opening up to you with my personal dealings with anxiety and depression. Keep hanging with me, fam. It's going to be a ride.